Hey guys, welcome back. I'm JessTheMD. Thank you so much for joining me. Today, I wanted to talk to you about the recent decision by the World Health Organization, otherwise known as the WHO, or for funsies, I'm going to call them the WHO because why not, to downgrade the COVID-19 pandemic from pandemic to endemic. What in the world does this mean? What does it mean for you? Let's get right into it. First off, let's talk about what this decision actually means. Does it really even make a difference for any of us? I mean, I feel like we've kind of gone back to living pretty much normal pre-pandemic lives with that little inkling of COVID right sitting in the back of our heads. What does it mean for us? On May 5th, 2023, the World Health Organization, the WHO, officially declared the COVID-19 pandemic no longer a global health emergency. This is super important verbiage. What it means is COVID is still a thing, it's still a problem, it's still a virus that can cause some major morbidity and mortality, but it is now considered endemic. What the heck does endemic mean? Well, I am here to tell you if you didn't already know. An endemic virus is a virus that is now considered part of the population. It's integrated, many have been either sick with it or vaccinated against it, and it's something that's a part of our everyday lives. This does not mean that COVID cannot cause major illness. All this means is that this is a virus that is now with the entire population, and we just have to learn to deal with it. The WHO stated that the risk remains of new variants emerging that cause new surges in cases and deaths. COVID-19 still claims the lives of many, and many are still in the ICUs fighting for their lives. The WHO made this big decision because they believe that COVID-19 is now a viral illness that we have enough tools to be able to manage without considering this a global health emergency. We finally have increased availability of vaccines, of treatments for COVID-19, so we can kind of put this in the background of all the other viruses that are causing illness in people. Listen, y'all, the flu, severe colds, RSV, etc., those kind of viruses still cause major illness and deaths in many of the population. COVID-19 is not the only one that does this, and it will not be the only one moving forward. The flu, RSV, and many other viruses can cause major illness in many of the population, from the very young to the very old to the immunocompromised. So, why has this decision been made now? I mean, I feel like we've been living without masks, getting back to normal for the most part for the better part of a year now. So what is different? What changed? The WHO made this decision for three main reasons. The first reason is because the World Health Organization believes that we have met the criteria to reclassify this from a pandemic now to an endemic virus. I tried to find these specific criteria, but they were kind of hard to delineate exactly online. But the one consistent point that I found is that enough people have to have immune protection against this virus. This then highlights the importance of vaccination if you have never been infected with the virus. Ultimately, it is up to you to decide whether or not vaccination is right for you. I personally believe it's right for the majority of people because future variants could potentially cause worse illness than the ones that we have now. We just don't know that information yet. The second reason is because the WHO's primary tool, the Public Health Emergency of International Concern tool, has played its role essentially. It was meant to be an emergency response to a major concern for public health, and it really has played its role in helping to manage this whole pandemic. But for now, it's going to be put into its pretty little box and not accessed until some other major pandemic hits the earth. The third reason is that the emergency committee members of the WHO believe that it is possible for the WHO to provide the appropriate messaging to the public without continuing to call this a public health emergency. When you say public health emergency, it kind of makes you feel like, oh, there's a crisis going on. And we're at a point where this is no longer a huge crisis situation. Yes, it's a serious situation. Yes, this is a serious virus for many, but it is not officially a public health emergency anymore. The way I understand this is basically, as a society, we have lived the last 3+ years through this major pandemic and have seen the massive effects of this virus. Lots of deaths, lots of long-term illnesses from this virus. And now we can move forward knowing the dangers of this virus, knowing how to protect ourselves, and reintegrate ourselves normally back into society. Yes, things are different. They will continue to be different, but this is our new normal. So you're probably wondering, what does this actually mean for any of us? And honestly, on the ground, in restaurants, in malls, in public, it really doesn't make much of a difference anymore because most places have removed their masking requirements. Masks are mostly now optional in places. So what difference does this decision make? Well, I think the biggest thing surrounding this is the wording. Changing this from a public health emergency to just, we know this is a virus, we know it is a problem, we just have to be vigilant and monitor and know what we're dealing with, changes the verbiage from feeling like this is a crisis situation to knowing that there's something that's dangerous out there that we just have to be aware of and manage. Now we can start shifting our focus from just trying to control the spread to learning to live with it and knowing how to protect ourselves, especially if we're in a population that's at higher risk for getting really, really sick from this virus. The World Health Organization's decision to downgrade the COVID-19 pandemic from pandemic to endemic is a significant milestone. It means that we are no longer in a public health crisis. We are managing the after effects. This is like the calm after the storm. We know there was a storm. We learned some things from it. We've developed new technologies, new medications, new vaccine strategies, and now we can move forward knowing a little bit more, knowing how better to protect ourselves moving forward. The concern is not truly gone. There are many people that will still die from COVID-19. There are many people that will die from the flu or from RSV. But I'd like to think that things are better than they were at the beginning of this crazy journey we were all thrown on. I also strongly believe that this decision can have a really good positive impact on all of our mental health. Again, changing the verbiage from this being a crisis, a public health emergency, to this is just something we're learning to deal with and learning to live with now is a huge factor in how we perceive what's going on in society. So get vaccinated if it is right for you. Stay healthy, not anxious. This was a major milestone for the entire population of the whole world, and everything is getting better. As always, it's super important to stay informed. Follow the latest data, follow the advice of informed healthcare professionals, and keep yourself safe, happy, and healthy. Please like the video down below, subscribe to the channel. It really helps the girl out. Thank you so much for joining me. I'm JessTheMD. I really enjoyed spending time with you. I hope you enjoyed spending time with me, and I will see you in the very next one. Bye.